Dr. Jennie Yoon, welcome back. Today we're going to start a three-part series talking about fertility in breast cancer patients. Today we're going to discuss effects of breast cancer on fertility. So why is fertility important? Well, let's look at some of the statistics. There are about 12,000 women under the age of 40 who are diagnosed with breast cancer every year. And breast cancer is also the leading cause of death in women under 40. The number of cancer survivors of reproductive age in the United States is now estimated to be about 500,000. So looking at these statistics, it's clear that breast cancer treatment today has to deal with not only the cancer treatment and survival of these young women, but also the quality of life for these young women in their reproductive age that needs to include fertility issues. A recent survey also suggests that majority of breast cancer survivors who have no children at the time of diagnosis would like to have them in the future. The survey also indicates that survivors who already have children, when they're diagnosed, would like to have more. Yet many report that these women do not or receive not adequate information at the time of their diagnosis about their fertility and how to preserve that at the time of the cancer diagnosis and when they're making decisions about their treatment. Before we can discuss how to preserve fertility in these women, we need to discuss how breast cancer treatment affects their fertility. As you know, chemotherapy uses drugs that targets rapidly growing cells, and these rapidly growing cells not only include cancer cells but also normal cells such as those in the sperm, the eggs, and hormone producing cells that are important in reproduction. And often these chemotherapy drugs that are used to treat the cancer render these patients infertile or leave them with decreased overall ovarian reserve, which means decreased number of eggs that can reproduce. So it's important to know that women like myself think that just because you're still menstruating in your 40s and 50s, you're still fertile, but that's actually not true. After about 35 or 40 years of age, the number of eggs that can actually reproduce decrease dramatically compared to somebody who's in their 20s. And also when we're talking about radiation, there's some concern that whether that affects fertility or not. But as you know, the radiation that's used in breast cancer treatment usually is centered around the breast, so it doesn't really affect the ovaries, which are located in the pelvis. Now, some of the treatment include taking the ovaries out in these young women because that has shown to increase survival in these women. And obviously, if you're lacking ovaries, obviously you can't make eggs, therefore you're infertile. But there are options that can preserve fertility in these breast cancer patients. The feasibility, the safety, and suitability of these different types of fertility preservation methods depend on your age, the type of cancer you have, the treatment, and whether or not you have significant other at the time of diagnosis. Well, that's all for today. This is Dr. Jennie Yoon. See you next time when we talk about actual techniques that are used to preserve fertility. See you next time.